Well, good afternoon, everyone. I appreciate everyone tuning in to this live chat here on July 21st. The format of today is very simple. Yours truly has some information to share about our COVID-19 dashboard, our preparedness plan surrounding the global pandemic, a little bit of information about our vaccination rates, and our preparedness plan. I do want to talk a little bit about some operational updates, mainly around Comcast, our our pool area, our beautician services, live chats with town hall meetings, and I'm going to round out this live chat talking about our continuum of care, our aging in place philosophy here at Cedarfield. So for starters, again, anyone tuning in tonight, listening to this video, feel free to certainly call administration or any one of the directors of Cedarfield tomorrow, and we will just answer any and all of your questions just as soon as we can. It is a delight to come in the next day and from each of these live chats over several months and retrieving questions and messages from our phones from people all around the world listening to the video. Our COVID-19 dashboard, for all intents and purposes, is green, but I just wanted to let people know that we did have one team member unfortunately come up positive over the last couple of days. This team member is working in assisted living. The good news is that there's a 48-hour period of time from when the person was experiencing symptoms compared to when the person last worked. So all that is great news because that incubation period and the viral load didn't have a chance to really accelerate while the team member was here at work. All of the residents that this particular team member came in contact with have been vaccinated, and currently there's no residents or any team member in assisted living that's exhibiting any signs and symptoms of COVID-19. And we don't feel like, after consultation with the Virginia Department of Health, we do not believe that we have to quarantine anyone and or section off assisted living to the rest of the community. So keep your prayers flowing for this particular team member, that they have a speedy recovery. Until then, we are continuing to test weekly, as we have been for several months, team members who are unvaccinated, so that we can unearth any symptoms that may arise with someone, and they may not even know that they have COVID-19. So that's our dashboard. Again, it's a very, very low risk item here at Cedarfield. Our vaccination rate climbed a little bit to 94% since we last spoke. There's a couple team members who did receive the vaccine outside of our community, so all that is great. We climbed from 92% to 94% over the last 2 weeks. In terms of our COVID-19 preparedness plan, we did just want to highlight a couple of things and items of our current plan, just to bring things again full circle, as a friendly reminder that all team members at Cedarfield, all private duty personnel that happen to be working at Cedarfield, and any contractor and or guests, it's all of our responsibility to continue wearing masks. Even visitors that come to the community to visit residents that live here, it is our protocol at this point that we are all joining forces and wearing our masks to provide that extra layer of protection. At this point, we are not at a point where we're inviting guests to the restaurants. Hopefully that will change here throughout the summer, but that that protocol is still in place. And we still obviously have the protocol down at the Gatehouse. The Virginia Department of Health just asked when we were talking to them the other day about this one positive case. She asked, the Virginia Department of Health epidemiologist did ask if we had the Gatehouse protocols in place. So that is still very much part of our preparedness plan. There was one team member that did want me to remind everybody that during this global pandemic, since we don't have guest suites that are available here at Cedar Field, if you have a loved one coming into town to come visit, we do have a really great rate over at Fairfield. So if you have a loved one coming in, a friend, just tell them to make note to their concierge desk that you're staying at Cedar Field, and they will get a really great overnight rate. And then lastly, speaking of guests for overnight, if there is any guests that are staying here overnight, there is a registration process that we still have in place for that protocol. And so if anybody has any questions about guests staying over here, staying overnight at Cedar Field, please see Ann Hopper in the clinic or Connie McGowan, our infection control nurse. A couple of operational updates. First is Comcast. We are aware that there is a fairly widespread issue with Comcast when you are shifting from one of our in-house channels back to a regular channel. There is a sporadic propensity that the TV will actually go dark for a little bit. Some people have a pink screen, some people have a blue screen, some people have a dark screen for a couple of seconds. Jack Johnson in maintenance and Comcast are completely aware of the situation, are actively working to resolve that issue. We don't have a timeline because they've not really, I'm quite sure of what the issue is just yet. Comcast is coming to the property again tomorrow to look at some individual resident cottages and apartments, as well as this community issue. I have some indifferent news about our pool. So the skylight in that pool area was not installed according to specifications from our architect and the subcontractor. And that skylight in the pool has some gaps between the skylight and the roof. So we obviously need to fix these issues within that skylight. Our general contractor has been working very diligently with a plan with the subcontractors that originally installed that skylight in the pool. I think they've come up with as tight of a plan as they possibly can make it. They are owed Cedar Field that plan here this week. They've been working over the last couple of months on the plan. As soon as they actually give us the plan and we are satisfied with that plan, then our agreement with them was that they can start 2 weeks thereafter, which on the plan itself right now is an 8-week project. I'm hoping, given a lot of information that I'm privy to during these meetings, that it won't take 8 weeks. But there is a chance that the pool will need to be offline for about 8 weeks. The start of that will be maybe the beginning of next week will be their 2-week window. So probably by the middle of August through the middle of October, will be that 8-week duration. I want to try to get this done before winter sets in. And so, I'm sorry, October at the latest. So, not the greatest news to share, but Carol Thompson, Florence Brooks, and myself are actively working with ACAC on an interim contract so that residents that do frequent the pool will have another option available to them. So more next week about that particular contract with ACAC. Unfortunately, again this week, we a lifelong contributor, strategic partner in Kathy Elkins passed away last week, and so there's that void in beautician services. I hope everyone keeps her and her husband in your prayers, Ed Elkins. Ed has made it abundantly clear that it's the intention to shut down that business. And so Cedarfield, yours truly, is working on a replacement contractor. I have two particular companies right now that help retirement communities of the scope and the size of a Cedarfield around the country. I have calls out to two of these providers. And so over the next couple of weeks, we will be interviewing companies that want to entertain coming to Cedarfield for beautician services. There has been some interest from the residents of having a town hall meeting back in replace of, or maybe in lieu of, these weekly live chats. We've been talking about communication here in the administration suite over the last couple of weeks, and I think we're going to scale live chats back to maybe every other week beginning in September, and then one of those, or maybe even both of those, since we typically do the filming of these live chats in the fellowship hall. If anybody wishes to come in person to the live chat, we're probably going to make that available. So we'll have a live chat, a hybrid approach, I guess, a live chat and a town hall meeting type of format twice a month starting in September. So look forward to more information about that communication avenue. Then the last thing I just wanted to chat about is I put a pamphlet in everyone's cubby box or mailbox in independent living and assisted living late last night, early this morning. There's been a lot of discussion around Cedarfield of residents questioning why are we bringing in Affirmation Home Health? Why did we come to be in partners with LifeSpire, creating a home care company, home health company, hospice company? At the same time, residents are questioning about the future of Helping Hands. And I thought it'd be good to take under advisement of Eldon Rutger and Mike Greenwood, take a kind of step back and talk about the continuum of care at Cedarfield. Or another term that we often talk about is the aging in place philosophy at Cedarfield, and try to pull all of this healthcare navigation, this healthcare system that we have here at Cedarfield, try to pull together maybe in the next 20 minutes here, and then have an ongoing discussion about this safety net over the next 6 months, so residents have a different level of confidence in what has been really built here, that safety net, that continuum of care for the last 25 years, and we keep adding to make it stronger. So I'm not going to read, for those of you that went down to your cubby box and or your mailbox, I'm not going to read every word on this pamphlet. I found myself typing away over the last 3 weeks about the strength, one of the strengths of really this campus, which has to do with this aging in place, this continuum of care concept. And so we're going to have an ongoing discussion about it, because I really think there's many people that think that this is one of the strengths of Cedar Field, and I aspire to that. And we should all have great confidence in this healthcare delivery system that has been here and that we will continue to add to it to strengthen the Cedar Field brand. So I'm going to start on page 1 for those of you that have this in front of you. Our goal has always been, I'm going to start using a new word to the continuing care discussion called navigation. Our goal has always been to help residents navigate the maze of offerings at a retirement community so that there's choices that residents can make, whether it's temporary or permanent choices, but help educate residents to the degree where you're making choices for yourselves along the continuum of care. When I first got into senior living almost 23 years ago, it was very simple. Residents that moved into a retirement community, you moved into independent living, assisted living, or healthcare, or you moved through that continuum, those 3 different phases. Today, fast forward to 23 years later, that has radically changed. The market, residents have demanded and asked for choices, for flexibility, and not having such a rigid continuum. And so over my career, I have seen retirement communities evolve to the degree where we are providing a safety net, all these other services to help residents age successfully. And so this document is an attempt to share with you. A lot of it was pulled out of the resident handbook, but this document is another attempt to show you the safety net that we have here at Cedar Field, and that we have been adding to this safety net, quite frankly, for the last 25 years. So on page 1, you can see the traditional continuum of care, which is great. It's part of residents' contract. You have independent living, assisted living, memory support, and a traditional long-term care nursing home, which now we refer to as household. And so a couple of the strengths of independent living have to do with pathways to wellness, the dining program, worry-free maintenance, housekeeping, and transportation, to name a very few amenities and services to independent living. The second is obviously assisted living. When we built Cedar Field 25 years ago, we had 42 apartments. What we realized about 10 years into the evolution of Cedar Field is 42 assisted living apartments was not enough now that we've aged 10 years forward. And so or backtrack, when we started master planning Cedar Field, we took into consideration that we did not have enough assisted living. And so part of our master plan renovation over the next 2 years is to add in 20 more apartments, assisted living apartments on the 4th floor. I'm going to come back to why is that really important in a minute. So we have memory support, which is assisted living in a secured location. We have been on a person-first journey, thanks to Nancy, my predecessor, since 2014, and quite honestly, we'll probably be on a person-first journey. It's one of those philosophies that really, it's a never-ending, it's a perpetual journey. It's not a program that you put a stamp on that you've come to closure. So it's a destination. It's a journey, not a destination. And that person-first philosophy is still alive and well in memory support. We have had a couple of successes here over the last few weeks. Many of you know Aaron Chauncey. We asked Aaron to become a Montessori receive Montessori-based training through a organization that has taken the Montessori traditional methods through schooling and applied it to older adults and people who live in nursing homes, retirement communities. So Aaron is now certified in Montessori, which our intention is to take the learning from that and have Aaron help us employ that philosophy throughout the memory support neighborhood. And then there's another emerging over the last probably 3 years, a company called OMA, Opening Minds Through Art. There's a couple of staff members already that are certified at Cedarfield through OMA, and it's our intention over the next couple of months to take OMA, Opening Minds Through Art, and really employ that in the memory support neighborhood. At the bottom of page 1, you can see some asterisks that define what Person First and Montessori and OMA are in a little bit of a paragraph. Number 4 on page 1 talks a little bit about our traditional fourth floor long-term care, again, that we've been on this Person First journey since 2014. And then these next 2 items, number 5 and 6, again on page 1, I'm really excited about adding these 2 elements to Cedarfield. One is taking the 5th floor of the new household building we just built and have an emphasis in dementia care on that floor. This comes right out of a request from the resident council for us to look at. And so we are going to project plan that 4th floor. So when folks that are moving through the continuum and that graduate through memory support assisted living but need a little more skilled clinicians around them, then they move through to a household and that specializes in dementia. So more information about that, but we're pretty excited about adding that level of continuum to Cedarfield. And then again, through the master plan expansion, it has always been our intention. We're one of the few nursing homes around the country that are not Medicare certified. And so we have begun plans now that we have the household building open and we can transition residents in that space and then go back to the 4th floor and renovate. It's the intention to have a 20 apartment neighborhood called a Medicare Part A therapeutic neighborhood, probably about this time next year. So very excited. The planning is starting and we're working with a consultant to make that application possible through Medicare. Very exciting level of care that will be available to residents here at Cedarfield. So that really is the hallmark, our traditional continuum of care here at Cedarfield. Oh, one more thing. On page 2 at the top, you can see there's 4 asterisks next to Java. Very exciting news to announce. We applied for a grant through Medicare. Medicare, through their survey process, when there's nursing homes around the country that have deficiencies that reach a certain level, there's certain fines that are associated with those deficiencies, and certain organizations have to pay Medicare those fines. What Medicare does is they put that money in a bucket, and then they use it purposefully to help nursing homes around the country with elevating quality of care and life through a grant process. So one of the applications that we applied for, not that we were fined any money, but we wanted to tap into that bucket of money and see if we could get a grant called Java Music. And just last week, we got approved for the grant. And so over the next couple of months, we're going to work with an organization called Java, and we're going to come up with, implement their music therapy program within our 3 neighborhoods in our long-term care setting. So between our Person First initiatives, our Montessori initiatives, OMA, Opening Minds Through Art, and then coupled with Java Music, the continuum of care here at Cedarfield should really be strengthened over the next several months. On page 2, you can see, again in red, some Cedarfield service lines and or coordination that I just kind of wanted to point out because these are really critical pieces to the safety net here at our community. One is called the Resident Care Committee. There's a group of team members, you can see they're listed, that meet every week and talk about episodic or trending situations that are happening around residents. And it's this care committee's role as an interdisciplinary team to talk about the situations and then brainstorm about what might be the next steps for folks. And then it's the job of the navigators, and Ann Hopper in the clinic or social services, Kathy Moran, or the neighborhood leaders or the clinical leaders in assisted living or memory support or healthcare. It's their role to communicate back to families and or residents about other services or amenities that we see that folks should start to consider in order to age successfully. So this resident care committee is just a critical meeting that happens religiously every week to talk about the strength of Cedarfield, this safety net, and dividing and conquering and going back to residents to help them understand things that they might want to consider in order to maximize their strengths and their independence. So the other couple of things underneath this section have to do with the wellness clinic. Absolutely, the clinic is a strength to this safety net. It has been for a long time. Ann Hopper and Bonnie Berry at the helm in the clinic. You can see the list of services that they provide in that clinic that are just critical. Another piece to Ann's role is a navigator. Her job is really to look at residents' situations and look at the strategic partners that we have listed down on page 2 and 3, and really work with Kathy and social services to make sure that we're bringing the family along and or the resident along of education about services and amenities, again, that residents should consider giving a variety of things that are coming up within their own aging process. On number 4, talk a little bit about Helping Hands, since Helping Hands seems to be a hot topic around Cedarfield right now. I just want to squash a rumor that Helping Hands is not going away tomorrow. That is a rumor. What Helping Hands, I'm going to back up a little bit about Helping Hands. So Helping Hands was designed and implemented to help people who needed to transition to assisted living. When we first designed this program, that was the original intent. Again, going back to the top of the hour when I was talking about assisted living, we underbuilt assisted living in the beginning. We only had 42 apartments. And so the intention is to add on 20 more assisted living apartments in the next 2 years. So Helping Hands was always meant to be a program that would dissolve once we added on assisted living apartments. And that is the God's honest truth. And so assisted living will not dissolve until probably April or May of 2023, when we have all of those assisted living additional apartments online. So please put on the brakes, whoever is talking about Helping Hands leaving Cedarfield tomorrow. That's just not the case. What has happened, though, through the pandemic is we leaned on Helping Hands, Tessa, Lori Shepard, and all the CNAs to help with a variety of things and services, because quite honestly, we were in preparedness mode, and it was constantly evolving of helping residents in their apartments through this pandemic. And so we probably went, well, not probably, we went beyond the scope of Helping Hands through this last year and a half. And now that we're rolling out of the pandemic, we need to get back to the original concept of what Helping Hands was. And that is to help people transition to assisted living. Helping Hands is not an assisted living replacement. It's not a memory support replacement. It's not definitely a healthcare replacement. It's a couple of services that help bridge the gap of helping a resident get from independent living to assisted living. And so that is really the role of Helping Hands. And so it may seem like we're trying to scale back and eliminate the program altogether right now. That's not the case. But we do need to get back to the basics of what Helping Hands is all about. Because we have this safety net. We have which I'm going to get into the strategic partners here in a minute. We have a really awesome safety net. And that really enables residents to age in place and take advantage of a lot of choices, temporarily or permanently. So going into that additional safety net that I'm referring to, we really rely on strategic partners to help us provide this this contemporary continuum of care, well beyond just independent living, assisted living, or skilled care. Cedarfield has many strategic partners that help us help the residents age in place successfully. And so we have medical directors here. We are blessed to have these medical directors. I've been in this business for 23 years, and I have never had the pleasure of working with medical directors that we have here. Dr. Varanian, for those of you that don't know, has been here since the inception of Cedarfield. His bedside manner, his expertise is quite frankly second to none. He's just such a pleasure to work with. And you can see the definition of a medical director in that section. A couple of years ago, many of you know that Dr. Shear joined us as a physician through a company that she owned. That company dissolved, and there was an opportunity there to bring on Dr. Shear, given her expertise from Texas all the way through Virginia, as a hospitalist and a medical director of a variety of senior living companies. There was an opportunity to bring her on as a medical director. So we talked with Dr. Varanian and said, can we strengthen the medical directorship at Cedarfield and have a co-medical director? And so Dr. Varanian serves as a medical director for independent living, and Dr. Shear serves as a medical director for assisted living, memory support, and health services. And it is a great setup. Both of them love being here, and again, we are just blessed to have both of them at Cedarfield. You can see the definition of a role of a medical director on the top of page 3. Moving down page 3, again, physician services are just really critical, and so we've added a complement to the team in the clinic, and as well as going over to health services with Dr. Cook. Dr. Cook's been here just a short time, but he's made a tremendous impact since he's been here. And so my words of encouragement to the residents, if you have had a physician for your entire life maybe, and you see that physician and that practice downsizing, and or you want a physician at the nucleus of a healthcare delivery system, you might want to consider Dr. Shear or Dr. Cook as your primary care doctor here at Cedarfield, because that strengthens your continuum of care that much more, since they're the very physicians that are here practically every day, working in and around all these other service providers and working with the Cedarfield management. Psychiatry, Dr. Shelp, again, has been here since the inception of Cedarfield. Not to sound like a broken record, but I've been in this business for a long time, and having a psychiatrist with the expertise and the compassion that Dr. Shelp has is really second to none. And so we are blessed to have Dr. Shelp come to Cedarfield. Moving on to number 4, yours truly in the past, a couple other companies had had the pleasure of setting up a nurse practitioner complement to the physician services of a retirement community. So when we came here to Cedarfield a couple years ago, we had an opportunity to interview Arden Aylesworth. Arden owned a company within Richmond called Legacy. He has since sold that organization, and I was approached through Dr. Varanian to meet with Arden about adding nurse practitioner services to Cedarfield. So Arden joined Cedarfield about 3.5 years ago as a nurse practitioner, working in concert with the physicians. Although he's got 3 designations right now, certifications, where he is licensed to operate independently, but they work very closely in coordinating care, the physicians in Arden. And I will tell you that hospitalizations that are all-time low within our health care, assisted living, memory support area, because the nurses and the clinical leaders and our Tamika, our new DDON, really see the value and have seen the value of reaching out to the physicians and getting opinion and expertise about situations to prevent hospitalizations. But more importantly, that coordination of care that's provided by the physicians and Arden is just really a pleasure to watch day in and day out. So we have physician services, we have nurse practitioner services, and then we formed this company. It's always been a goal of ours over the last couple of years to form a company that has 3 levels of care underneath the umbrella: hospice, home care, and home health. There are hundreds of organizations out there that specialize in home care, home health, and or hospice. And traditionally at Cedarfield, we have contracted certain organizations to come to help supplement those levels of service to Cedarfield. We believe that it helps us have a stronger safety net, a continuum of care, if we owned our own organization. And so Chris reached out to a number of providers in the marketplace. Chris Henderson, that is, Chief Executive Officer of Pinnacle Living, and LifeSpire, Jonathan Cook, the CEO, and Chris just really felt the need to join forces and develop a company on behalf of the residents that we serve. And so Affirmation is alive and well. We have 6 residents of Cedarfield under their care, under Medicare Part A home health services. And so we have this piece to our continuum. We have the availability for Ann Hopper and the clinical leaders in the health services help navigate residents to either one of these 3 service levels over time, to help residents make choices and to get either therapeutic and or clinical care to the resident in the least restrictive environment. So home care is off the ground. In the next couple of months, it's aspirations of Affirmation to begin home care services, private duty home care to supplement care that residents already receive, whether it's in independent living, memory support, assisted living, and or the health center. And then 18 months from now, we will begin the process of offering hospice underneath that Affirmation organization. So number 6 on page 3 talks about Health Pro Heritage, which is the Medicare Part B services, therapeutic services that are offered at a retirement community such as Cedar Field. Many of you probably remember Genesis that we had for many years, and then we transitioned to Health Pro Heritage here in the last 2 years. In any one given average day, they see, in a given month, they see approximately 100 residents, which is just phenomenal. That their expertise, you can read the paragraph I typed up in there, their expertise has reached a degree where they consistently are seeing about 100 people a month. And I say that's great news because stuff happens. Things pop up. They just surface. Aging is not easy. Not easy for me. I got a bum right knee that I have to go get checked out here in the next month or so. So things happen. And the fact that people are now just walking into Health Pro Heritage and saying, I think I need to get this checked out, as opposed to Ann Hopper, to complement what the clinicians are saying with residents. We see often residents just walking in themselves and saying, I got to get this checked out. So it's a blessing that we have Health Pro Heritage with us at Cedar Field. They are a national provider across the country. Their expertise is second to none. 4 of their patented programs I typed up there: Ageless Abilities, Defying Gravity, Safe Transitions, and Wellness Program. We are taking advantage of these 4 patented programs through Health Pro Heritage. And I would encourage you to learn a little bit more about each of these. And we'll do our job to communicate what these 4 patented programs are more about within this organization. But this is another layer to our safety net here at Cedar Field. Absolutely, pharmaceutical services is critical. It has been critical since its inception. Many of you took advantage of Westbury's services while they were here. Many of you still do connect with Westbury on 3 Chopped. The last couple of years, we've had Remedy Senior Care. Remedy Senior Care is a national provider as well across the country. It's a pleasure to have them with us. And residents have available 20 hours a week with a pharmacist down there in the pharmacy adjacent the Atrium Cafe. So if you haven't thought about transitioning pharmaceutical approach to Remedy, our in-house provider, I would strongly encourage you to do so. Again, because if you're working with CVS or Walgreens, you may not have that personal attention with a great price that you may otherwise have with Remedy Pharmacy. Another great provider that we have on board now is Dispatch Health. Many people don't want to go to the emergency room. There are certain things. So Dispatch Health is a emergency room replacement plan. They have 5 nurse practitioner cars now in the city of Richmond, and they're very accessible. They can't handle everything. Obviously, there are some things that if someone's experiencing congestive heart failure or stroke-like symptoms, we want to call 911 and we want to get people out to the acute care setting. But there are many things, like 3 months ago when I was having an episode of dizziness at my home, I called Dispatch Health and they came out to my home and they helped with my vertigo. I had a really wicked spell of vertigo, and they came out and helped me in my own home. They can triage many things right in the comfort of your own home, whether you're in independent living, assisted living, and or the health center. So we have that available to us. Number 9, we have available other home care, home health, and hospice providers that have been with us since the inception of Cedar Field Affirmation's not the only company. We really have to promote choice, and so we have other providers with us to give residents those choices. We have a dentist available. She's been with us for a long time. Ann Hopper and I and Matt Dameron just met with on-site dermatology, which we'll be bringing on in a couple of weeks. We've had a partnership with Deer Oaks on-site psychiatry and psychology through some licensed social workers. So we've had that level. We have laboratory services, radiology services. And then one that's going to be emerging here, we've had a couple of meetings over the last couple of months with Ally Senior Care. This company's been it's a Richmond-based organization. You can read that little paragraph for yourself, but we been meeting with this organization to help understand the benefits of a Medicare Advantage program that we could maybe work with them and bring to Cedarfield. And we're just really delighted with how this organization has evolved over the years. And so more information to come about a partnership with Cedarfield and Align Senior Care to offer residents another insurance product that might be able to replace your traditional Medicare plan and many of your supplemental plans to get you more coverage, more preventative services through this organization. So I'm really excited to start planting the seeds about this particular strategic partner here in the very near future. So I know that's a lot to digest. It's complicated. Healthcare in general is very complicated, and we have a complicated system here at Cedarfield. That's the good news. There's so much to it that it's complicated. We have a very accomplished resident that lives here. You've accomplished great things in your lifetime. You've prided yourself on wanting to know how all the pieces fit into certain puzzles. We have captains of industry here at Cedarfield, and people want to know how everything works. This is very difficult to explain and try to fit it all in. And that's why I strongly believe it's one of the strengths of Cedarfield. This aging in place continuum of care, this navigation is a huge strength of Cedarfield. It always has been. And a new word for me is navigation. We are navigators helping residents navigate through this. And so when I hear residents saying we're pulling out the carpet from the residents because we're taking away helping hands, or we don't really need affirmation home health, the message I hear in all of that is that, quite frankly, management's not doing its job of educating the residents about this safety net, this continuum of care that you have to help support residents through the aging process so that you have choices of which to take advantage of temporarily or permanently so that you can age successfully through the continuum of care. This can be all offered in independent living, assisted living, memory support, or even healthcare. It's a strength to Cedarfield. There's a lot of trust that's involved with kind of opening up and let people help you navigate through this puzzle of healthcare. And so I am committing to anyone that's watching that we're going to do a better job over the next several months, if not the next 12 months, of taking different pieces of this and helping people see how it all fits together so you have a confidence level in one of the strengths of this very community, our continuum of care, our aging in place continuum. I am very proud of it, of where it is today, And as I know of the history going back to 1996 and see how that has evolved over the last 25 years, I really could not be more proud of managing this community with the residents and the team that we have to continue to bring to life the continuum. So I'm making a commitment to do even more communication so that you have a trust level about this safety net, this continuum, and the navigation that we really want to help residents through, so that you're picking certain services to help you age successfully. So if anybody has any questions about this very difficult topic to communicate, please reach out. Certainly feel free to reach out to the administration office, the physicians that are listed in here, the clinic, social services, Florence, the directors. I forwarded this document to everybody. We're going to make a commitment to continue to talk about it. But if anybody has any immediate questions, please feel free to reach out, and we will attempt to answer any and all of your questions just as soon as we can. And then when we start live chats in September, combined with a hybrid of a town hall meeting where people just come to the fellowship hall, hopefully we can begin to really learn from each other and learn from the questions that are asked, maybe in more of a live audience, and all benefit from the wisdom of the collective group. So I think that's all I have today. Do we have any questions, Renee? We have no questions that have come in. I don't hear any questions, or Renee's tied up with something else. So thank you again for listening. I really appreciate the value of your time. I know that it was a lot of information to digest, but one, I think it's important to communicate, and we'll continue to communicate over time. Have a blessed day, and I look forward to talking with you soon. Thank you.